self-confident anymore. So this was the vignette, and after that the participants were asked if they perceive this situation as a violence. Most of the cases they answered yes. There was some participant who mentioned that because she's already 45 years old, she don't need to think about those things because she's finally married. So.
I have a related question. I know that you were investigating also the existing legal
Yes.
framework. So what are your findings? For example, if the general practitioner notices something according to the regulations, what he or she is supposed to do?
By this moment, there are no regulations which are framing the practice of doctors, healthcare providers in this area, because there is kind of an oral agreement between police and medical sphere. I was not able to find any realistic document, law, order, which will show the direction. But most of the healthcare providers mentioned that in the case they identify any physical injury, they report to the police. That's all. They had a book where they wrote about those physical injuries, and then just call to the police, and the police is coming to the hospital or the polyclinic. Most of the GPs mentioned that they themselves are not doing that. When identifying a physical injury, they are referring the victim to the traumatologist, and only the traumatologist or the surgeon himself or herself refers the victim to the police.
Thank you, Zara. I have a question regarding the analysis. You said that you did directed content analysis, and I wonder whether you have a theoretical framework or what helped you to structure the coding matrix and how detailed these matrix were initially at the beginning.
Yes, so I used, as you mentioned, directed content analysis, and this was based on a theoretical framework. It was knowledge, attitude, and practice. And I also added barriers and facilitators because there was a very similar study made in the United Kingdom, and they used this type of theoretical framework in their study. So I adapted it and used it for the study.
Thank you, Zara. I have two questions. The first, I wonder, did you have any inspiration for selecting this topic? And the second question, what this thesis project did give you in terms of experiences, challenges, etc., and maybe personal conclusions that you can say. Thank you.
Thank you for the questions. First of all, I was inspired because the field of women health, women rights is the most interesting for me. And also I got more inspired when I read Yelena Sardarian's topic, her thesis work. If I was unsure about my thesis topic before reading her work, after that I was for sure ready for for this. And it actually, let me answer in a little bit other direction to your question. It was very difficult for me to talk with the participants because some of them were telling very not, in my opinion, not right options, and it was very difficult for me to stay silent. So I learned to stay silent, probably, and to be more professional, so said.
Okay, thank you very much. We have 3 more presentations to go. Since we are ahead of our schedule, if you don't mind, we can take a short break, like 10 minutes. Now it's 5:05. We will resume 5:15. Okay?